All right. So, hello, everybody. This is Jorge Ferraez, publisher of Latino Leaders Magazine. And we all in Latino Leaders are very, very proud and happy to have a very distinguished and interesting panel of leaders that are doing something extraordinary to help and to support. But also, they are taking, a lot of other resources and a lot of other ideas to make something work out. And with that, I think we have a very interesting conversation ahead of us. So first of all, I want to introduce them very, very quick. I will just name their names and positions, and then I will ask them to introduce themselves. So first of all, we have Carlos Cruz. Carlos, he is the CEO of the Guiding Principles, licensed Santiago Shingo affiliate, certified Shingo examiner, and certified Shingo sensei. Carlos, welcome and thank you for joining us here. We also have Maria Juliana Arenas. She's Chief Operating Officer of La Magdalena Medical Unit in Barranca Bermeja, Colombia. Maria Juliana, welcome. Bienvenida. We also have Dr. Bob Emiliani, who is a professor of lean management. Sorry, Bob, thank you for joining us.
It's my pleasure to be here.
And we also have Dr. Cynthia Young. Dr. Young is president and CEO of CJ Young Consulting, knowledge management expert, TEDx speaker, and author. Cynthia, welcome.
For having me.
Thank you. Well, we have a great panel today. So I will ask some of the speakers to start introducing themselves. But before, I just want to give you a vision of what we're going to do. So in Colombia, we have this medical unit, as we say in Spanish, unidad médica or hospital also, that have been very, very bad impacted with the COVID-19 pandemic and situation there. As many other countries in Latin America, some of the hospitals, especially in small communities, sometimes they don't have the resources that they need to take care of all the patients and all the people that are going to this medical unit to get attention, medical attention. And so with this, a leader like Carlos Cruz from the Shingo Institute and his company, the Guiding Principles company, raise his hand and say, well, we can help. This activity, professional activity that I'm doing can help, and I can get, gather leaders and other experts in this area. And with that, they are doing an extraordinary action to help this hospital. But I'm not the one talking about this. I want them to be the ones who describe the great job and the effort that they are all doing. So Carlos, let's start with you so you can also introduce yourself and give us a little bit of the perspective and framework of what we are going to talk about.
Oh, thank you for that introduction, Jorge. My name is Carlos Cruz, and I'm CEO of the Guiding Principles, and where our symbol is the phoenix, which we use as evolution and revolution for our theme. And what I'm passionate about is about helping people. It's working with the community. I've been in healthcare for over 15 years in different types of roles, especially when it comes to process improvement and organizational strategies and understanding, patient care here in the United States. So that really is my passion, and I feel that as part of a give back to the community of the years that I've acquired experience, I like to share my experiences with others. At the same time, continue to grow that knowledge by understanding the changes that we're having. Like now that we have this COVID-19 event that happened out of the blue, just came out of nowhere. What are the lessons learned from this, and how can we recover as not only as a country or as Latinos, but as the world population itself? And I'm also very passionate about the Shingo Institute and the guiding principles of Shingo Institute. I've been working with Lean Six Sigma and Lean for a good 10, 15 years as well. And unfortunately, what many engineers like myself, especially before, during, and now after the COVID pandemic has happened, many have been laid off of their jobs because the companies have not seen results just by applying these types of tools, which are supposed to save money and provide real advancement in companies' ability to be more effective and to generate revenue. So now, what's the difference between that and Shingo? Well, we're going to discuss that as we continue our conversation. And I just wanted to give myself a brief presentation of who I am and what is it I do, and then discuss more deeper of how the Shingo model is working at the Magdalena Hospital. And by the way, the Magdalena Hospital project that we acquired and committed to is a 3 to 5 year project that we're doing as a humanitarian effort. It's completely free. So we're deploying the entire Shingo process to the entire company, to the entire hospital, which is made up of 380 employees and over 300 beds. So it's not a small clinic. It's more of a mid-sized hospital in U.S. standards. And with that comes the same challenges, maybe even more challenges than what we have here in the United States. So I'll leave my other team members to talk about that process.
Excellent. Thank you, Carlos. Dr. Cynthia Young, can we go next with you?
Well, as you heard, I'm Dr. Cindy Young. My passion is knowledge management, and that's really what I set up my company for, was to help organizations use their knowledge better, learn how to share it, how to transfer it, how to create knowledge so that they can improve and innovate their organizations. And I think working this project with Carlos and Bob and Maria, that we're going to be able to help the team share knowledge more between each other, so that when they get patients in there, word gets faster down the line about what they need to do to support their patients, as well as have it be throughout the whole team, not just the doctors and nurses, but from the person that checks somebody into the hospital to the person that greets them at the door, all the way up to the doctor that works with them. Because the intent of knowledge is to share it, to make things better, not to hold it back and be the person hoarding it.
Excellent. Thank you very much, Dr. Young. Now let's go to Dr. Bob Emiliani, because I want to intentionally leave at the end Maria Juliana Arenas, so she can also start talking about the situation at La Magdalena. So Dr. Emiliani, please.
Sure. So my passion is lean leadership, and I came to this passion as a result of learning about and participating in Kaizen activity back in 1994. And I did so as a manager of a business unit. And it was fascinating to learn the Kaizen process and the kinds of improvements that could be achieved in Kaizen that were good for not only the business, but good for the people as well. But one of the things I noticed right away is that my peer managers were not absorbing the lessons uniformly. So some managers continued to lead the same old way, and other managers like myself were absorbing this information and trying to lead the organization in a new way. And so that started me on the path of asking questions. Well, why is that? Why are we both learning the same kinds of things, but we're absorbing the information differently or not? And so that led me on a path of understanding, what is a lean leader? How do they think? What do they know? What do they do? And subsequently also led me on the path of how come some leaders don't want to change. And so that's been my passion.
Excellent, excellent. Thank you, Dr. Emiliani. Now, I want to go to Maria Juliana Arenas, and besides asking her to make a little introduction of herself, I would like Maria Juliana to ask you about if you can give us a little bit of perspective of what is La Magdalena, where is it in Colombia, what kind of community is this hospital embedded in, and what is the situation right now with the health crisis of the coronavirus and COVID-19. Please.
Okay, so, well, my name is Maria Juliana Arenas. I am a psychologist. I am from a university in Bucaramanga City. And I have been the chief of the psychology department for almost 2 years. Our hospital, the clinic, is located in Barranca Bermeja, which is a city near from the capital, not Bogota, the capital of the how do you say, of the state. And it's almost a city. It has grown a lot because the oil, many oil is processed here, so it has become like very popular. Our hospital is between the second and the third level here in Colombia. The services are classified between the kind of services that are given. So we are like in the middle. And well, since the pandemic time, things as where everyone has changed, we have had to make a lot of changes, infrastructure changes, also in our processes. Our people were not prepared. I mean, we didn't expect this situation. We have had to change their functions, their areas, working areas. So, well, it has been, at the beginning, it was really chaotic. We have been working through this process, and we are so thankful. I want to make a public gratitude message for our team, because they have been so dedicated, and well, we are so excited about it.
Could you share with us a little bit of for example, how many patients does the hospital has now? How many beds, or what's the capacity, and what percentage of the capacity is it? What percentage of your patients are now with COVID patients, and a little bit of the numbers that you could share with us on that situation to see what have been the impact or the challenges that you're facing.
Okay, so about our capacity, at the beginning we were not too crowded, but now the number of COVID patients has increased. So we had to change the ubication of the COVID patients in the hospital. We just have one floor, but with all this emergency, we had to adapt 2 floors, and we also have to change the workers to this area. So in this moment, there are very, I don't know the exact number in this moment, but there are these are much people with the virus, and there are also other diseases that continue existing.
Mm-hmm. And what have been your biggest challenges, your biggest needs, the situation that has been difficult for the hospital and you to face, which was probably the initial link or the initial relationship with the people that are helping, like Carlos and Dr. Young and Dr. Emiliani?
Okay, so my focus is on the mental health. So we have been working with all the people, with all the nurses, doctors, the people who work in administrative areas, for all the symptoms related to depression, anxiety, problems with sleeping, eating problems, because all these kinds of situations can emerge from the COVID disease. And well, I worked with 2 psychologists also, so we have divided the hospital in between the 3 of us. And also we have been doing some work with the people that are in home, because they have the virus or they could have the virus. So we are calling them, but there are too many things that we need to work because it has caused a lot of stress. Also, the functions, the systems, the tools are different in these times. So, well, we have to adapt to this situation.
All right. I would like to go now to Carlos, please.
Yeah. Yeah, so Jorge, to help answer that question, and in all fairness, when the conversation started, Maria Juliana was not involved. She was assigned the project by the president of the hospital, which is Dr. Arenas. So the conversation started off with understanding what was going on. Dr. Arenas, um, uh, we have family in Barranca Bermeja, and he's been a family doctor of our family for decades, for a long, long time. And one thing that caught my attention is that he still remembered our family's cases and how he took care of our family when they were sick. And now he's the president of this hospital and several other entities. And we had a long conversation with regards to what's going on deep, deep inside the hospital, the Magdalena. And the basic needs were, things like bedspreads and pillows and sheets and blankets. These are things that are destroyed after a COVID patient comes in. So, Maria was saying, that there's 2 floors now full of COVID patients out of a 4-floor hospital. I mean, that's more than 50% of the hospital capacity that's now taking care of COVID. And imagine all of 50% of all of the supplies that are destroyed, literally, because they cannot be reused. At the same time, there's a lot of budgeting and financial issues that have impacted because of the COVID, and it's made it very difficult for the hospital to purchase any of these things. So you'll have patients that are in hospital beds and they won't have enough of the basic needs that they need for their own care. So that's why we decided to, there's a systemic problem within the hospital in understanding what are the processes that are going on. And also there's a leadership issue that's going on there that has to do with all the other functions within the operations that's causing this. Some of it is controllable. A lot of it is just because of the logistics and where the hospital is located and culture-wise, how things are done in Colombia. So the challenge is changing that culture, changing the behaviors, so that now we have a much more sustainable system in place, not only to take care of this coronavirus and patient care and also staff, but also to be sustainable enough to be prepared for any other future events. And that's why since Dr. Maria Juliana Arenas was assigned, as she's the operations person, she's had mostly all the staff reports directly to her. The president assigned her to this project, and she's been active ever since. And I have to say that without her cooperation and her assistance in getting the entire staff on board with this whole idea, this whole concept of change, which is cultural change and behavior change, which is much more difficult than just plugging in some kind of software or plugging in some kind of hardware. Without that help from her and her department in psychology, we would not be able to be successful. Because with her, she's able to work with her internal staff and also the general public with regards to understanding why we're changing, the impacts of these changes, and then she's also monitoring and measuring using her psychology skills of the impact it's having on the people and the community. So this is something that's not just a question of we're going in there, we'll do a fun project for a little while. This is a 3 to 5 year engagement which we're working on, and we committed to this to the president of the hospital, Dr. Arenas, and he was excited about that. He got on board immediately, and he made every resource available possible to us. We could not be happier than that. We now have carte blanche pretty much to go to the hospital, walk around, do our jobs, and be part of the team. And they know that we're there to give them a community service and a humanitarian effort to help save lives, not only of the patients that come in, but also the staff that works there, that their lives are also saved by putting in new processes that will protect them as well.
Now, how did you figure it out, and how did you design the strategy to build yourself and the team that is helping La Magdalena? What was your approach, and what are you doing in that sense?
Well, this is not a one-man show, and it's totally impossible for us to do this alone. You need some expertise on the side that understand operations, leadership, and knowledge management. Because these are the three things that are really lacking that cause the problem. The Shingo model provides the cultural behavior, systems, and tools that will maintain the sustainability of these changes once they're implemented. But just to get off the ground and changing the culture and also changing the attitudes of the leadership, I had to find people that are direct enough and knowledgeable enough that understand the depths we have to go to. What I like about Dr. Bobby Miliani, who's been doing this for a very long while, he is a very straight shooter, and he says it like it is. He talks about leadership and the lack of leadership, and knows how to correct when bad leadership practices are being done. He's got that down to a science. As a matter of fact, he's written over 20 books about this, and that's something that is invaluable. You just can't buy that anywhere else. And Dr. Cindy Young, who's also an author and also a knowledge management person, very well known, she has not only the knowledge of knowledge management, but also she's a 21st century innovator. She takes her knowledge that she knows about knowledge management and she's continually improving it. So she's not stuck back with ways that are done back in the 70s or 80s or back when knowledge management was even started. She's an innovator herself, and she's also creating better tools and better methods of capturing this knowledge management. And that's what we need. We need cutting edge innovation, and we need leaders that know what's going on so that we can be able to meet this challenge. This is a huge challenge, not because of the COVID, but because we're dealing with people and cultures that have had a way of doing things for a long time. And to create the change, just to get to the status of stability will take at least a year. And from there, we'll start building up with other tools as knowledge management and leadership building and training and certification of the staff. So that was the thought process that we started this whole process to get up and running, understanding the whole picture, the whole scope of work, which was involved. It's a lot of people. There's 380 employees, and for us, every one of them has a voice, from the cleaning lady all the way up to the CEO and the president. And we've taken that into account, and we've made that very clear. And like I said, that without Maria Juliana's help and the president of the company, we would not be able to be successful. Even though this is a humanitarian effort, that assistance, that sponsorship, that ownership of their role is what makes this a success.
Mm-hmm. Now, should we now ask Dr. Emiliani to describe from your side what is the main challenge that you're facing and the actions that you're doing there?
Well, leadership, lean leadership requires a different way of thinking, a different way of understanding, a different way of doing things, different way of approaching people. And so there are some preconceptions about what leadership is that need to change. There's adjustments that have to be made in people's behaviors, adjustments in terms of their competencies, but also the preconceptions relate to people's beliefs and what they believe in. And oftentimes the image of a successful leader is somebody who's very difficult and tough on people and very demanding, very demeaning. Somebody who yells, maybe throws objects at them, or in the office, something like that. And in the world of lean management, we speak about the two principles: continuous improvement and respect for people. And so one of the principles, respect for people, has obvious consequences with respect to not demeaning people, belittling people, yelling at people, throwing things around. But respect for people also means challenging people to do better, challenging people to be better leaders, and making them a bit uncomfortable in that they have to rise to the challenge of becoming a better leader because they have significant responsibilities. Leaders are responsible really for the health and well-being of people for the 8 or 10 hours they are there at work. So leaders are kind of like the physicians of business. And you want physicians who practice a business, who practice leadership very well so that they help improve people's health when they're at work, mental health in particular, so that they leave work in a better mental health condition than maybe when they arrive, having to fight the traffic and get things sorted out at home and so forth. So that's the main goal of what we're trying to do, is help people understand that there's a different, more effective way to lead that's better for a leader, better for the followers, that overall better for human health, and produces better results for the business and the people in that business and the people associated with the business, which will include suppliers, obviously patients, taxpayers, whatever the funding source of the hospital is, and so on.
Mm-hmm. Okay, and now I think we should go to Dr. Young, so you can explain to us a little bit on from your view, from your position and your role in this task force. How are you seeing things, and what are the strategies that you're implementing?
Well, one of the things that we've discussed is conducting some basic introductions to knowledge management, what it is, and how it can best support the hospital as a whole, which, knowledge sharing is huge, knowledge creation, knowledge transfer. One of the things that is misunderstood is that knowledge management is sometimes looked at as a SharePoint portal or a way of filing. And that's just a small part of knowledge management. What we really need to get down to is how we're going to use the knowledge and who we're going to share it with, because a lot of times when you have organizations that don't share knowledge, people leave. And with that goes the knowledge that has been gained, as well as the comfort level of the patients, in this case, with their health. So what we want to do is we want to talk to everybody and find out, where they're feeling they're included or not included. And because knowledge management is big on inclusion, it really helps. You talk to the person, if you're in an office, you talk to the person at the desk next to you, and you share some knowledge. You share what you know, how to do something better. And right away, they look at you with confidence that they are on the same team. And so that's really the goal of this, is to get knowledge shared throughout the organization, as well as to help create it, help lessons learned, share lessons learned throughout the company, and also pass it down to the future generations of the hospital employees that come through the organization.
Now, Carlos, before going back to Maria Juliana, are you a doctor, a PhD?
No, I have a master in neuropsychology.
Okay, because I didn't want to. I didn't want to address you as a doctor unless this. But Carlos, so what else is the Shingo model bringing to this formula? I mean, what have you observed maybe in other cases or in the past that the model can apply to situations like La Magdalena?
Absolutely, and if you allow me, I want to share my screen, and I can help answer that question. Let me just put my share screen here on, and that way it's easy to understand just exactly what the Shingo model is all about.
Mm-hmm. All right.
So let me go back here. Oh, wrong slide. Okay. So the Shingo model is interacted, and it has to do with, in the center where you see it's changing the culture and the behaviors of people. Very much what Dr. Milgani said. And the Shingo model has 10 guiding principles. And the first 2 guiding principles have to do with leading with humility and respect for others. Now, those 2, I think, would be something simple. You have expressions, people saying that servant leadership, that there are leaders that go beyond, but we know that that's not really the case in many situations. especially in countries like Latin America, where leadership pretty much has the final word of everything. It's not questioned. Employees really don't have the ability to ask questions or question the leader about something that's going on that's wrong or maybe wrong. So changing that mindset is the heart of this project. As you see there, changing the culture and the behavior. Next, what comes from there is the systems that support that. Now there's systems that are in place that may be defective, that are creating certain kinds of behaviors from doctors, nurses, and so forth, that right now are counterproductive, that are not allowing that the systems and the operations work evenly and functionally. The fact that the whole hospital is in a chaotic mode, although the COVID doesn't help, but it's the hospital has had a reputation for a while locally with the town as not really a high standard, excellent location. So we're changing that. We're changing that now so that it'll be known as a center of excellence when it comes to healthcare and treatment. Of course, applying these principles, notice there on the right-hand side, you have the principles broken down into 8 different major categories. These systems as well are tied into the tools that are being used. Like Dr. Meliani said, he's a lean practitioner, and a lot of lean practitioners use a lot of Kaizen events. These are tools that, when used effectively, have excellent results. What happens today is that many organizations, even here in the United States, focus only on tools and don't take into consideration that there are systems and cultures and other types of behaviors that are impacting the effectiveness of these tools. So then you go back to, like what Dr. Mariani says, these behaviors that are non-compliant or non-ideal. They're not ideal behaviors. And at the end of the day, your results are not ideal either. So we don't want to just provide numbers that say our KPIs or key performance indicators are at X% and that we've improved, so on and so forth. That has no value at all until the culture has changed mentally and internally and has an accepting and understanding that it has to treat everyone equally. And this in a country like Colombia or in Latin America, and us as Latinos, we know this has to be a fact, that our culture is one of very old mindset that the leaders are the ones who are the bosses and not to be questioned, and you do as we say, not as I do, and so forth. So we know that this is a huge challenge just because our Latino culture is built that way for centuries. And now to change that, not that we're changing it to a different country's culture, but we're doing it into an internal change, more of a personal change. That's where the challenge comes in this project. So the Shingo model is very key in helping us to do this, because when it was built back after the Second World War and then evolved into what it is today, it always had as the center of change was the people. And just reverberating what Dr. Meliani and what Cindy said, capturing knowledge and understanding where that knowledge is, where it's located, and the value of that knowledge, not losing it. In countries like Latin America, if you have a good doctor, you don't want to lose that good doctor. It's very hard to keep it. But sometimes if that doctor leaves or that nurse leaves, you lose all that knowledge, all that experience. And then what happens to your quality and overall service? It goes down. That's why some places have then bad reputations. And that's what we're trying not to have anymore with regards to the La Magdalena. Magdalena has improved a lot. It has invested a lot in rebuilding not only the building itself, but also in rebuilding itself as a company, as individuals. And they do have they have an excellent team on board that has the openness and the humility to understand that the problem is with them. We have to change. That's their attitude. In other words, if we want the hospital to be better, it's up to us. And that's why we're reaching out to our Latino community here in the United States to understand that your brothers and sisters that are in other countries, we need your help as well. We know that your expertise that you have acquired here in the States and the knowledge that you have will help support initiatives like this at the Magdalena. And that's what is so important about this project. This is a life-saving project. It's very important that we understand that point of it.
And Carlos, let's make a space for one of the questions that we are receiving from some of the attendants, and it's about what you all four have been talking, which is the pandemic or the COVID thing has impacted mostly on healthcare workers and hospitals and medical organizations and institutions, harder than any other places, because there are like the epicenter of the cases of the people that are either dying or very sick and they need treatment and there's not enough. So the environment is really hard, is very tense, is stressful. I mean, you talked about, Maria Juliana talked about mental health, and there's a lot of mental health issues now in the physicians and medical community on going to a hospital and working there, and their families getting infected. And so the questions that we are receiving, one question we're receiving is, what can be done from the Shingo model and from Dr. Emiliani's lean management philosophy, and from Dr. Young's share of or knowledge share policies or strategies? What can be done to fight these situations in hospitals, not only in La Magdalena, in Barranca Bermejo, in Colombia, but all over the world?
Well, it comes down to understanding the behaviors of people. Just look in this country alone, where we understand and we know that for a fact that science has proven that wearing a face mask will prevent you, at least help prevent you from getting a COVID sickness. Okay, behaviors that are going to contribute to your safety and to the betterment of your family and your community are things that need to be applied and used. In the hospital, we're changing the behaviors of the staff to understand that it's not only what you practice in the hospital as safety and sanitary for COVID, but also what you practice when you go back to your communities at home. So changing the culture internally is changing your behavior as well. Understanding that, for example, eating with humility, which you respect others by doing that. You're focusing on specific processes and you're maintaining self-consistency to that process. That's another problem. When there's no consistency of purpose of maintaining stability and sustainability, things fall apart. They start off okay, and then after a while, people get tired and bored of them. That goes back to behavior. People return back to their old habits, and they go back to behaving that is not ideal, and it's not sustained. That's when you have to come in and you have to readjust again. So the sustainability part of it has to do with a lot of discipline and changing the culture itself. The culture is most of the times built around leadership who have imposed their cultures on it. So if you go to many organizations, the culture, the way a company works is because senior management says, this is the way we do business here. And either you adapt to that culture or you go somewhere else. And we're saying that's the wrong culture to be imposing. That's what Dr. Emiliani is saying. That's the wrong way to lead, okay? And that's what Cindy is saying. That's the wrong way to keep people within your organization, where you're gonna lose that knowledge and valuable assets that you have within your organization. So leadership mentality and culture is the first step that has to change, where it says, as leading with humility, I'm willing to accept that I have employees that have knowledge on the floor, and that me as the culture will change so that the company's culture will change. And that is shared on with the other leaders within the organization.
Mm-hmm. I don't know if either Dr. Young or Emiliani would like to add something.
Cindy?
Yeah, I just want to say that, leadership, once we get a good leadership team that understands the value, I mean, there may be people there that do this and it's not obvious, but, share the knowledge, share what they know, maybe somebody new because if they have a high rate of attrition, they're getting new people in there all the time because they have to hire replacements. If the doctors and the nurses and everybody who is involved with patient care talks with the new people coming on board at the hospital, then they will get a better feeling of trust because they're being included. And also they're learning something. They're learning how to better care, even if they're the janitor, how to clean a space better, how to make sure that they are maintaining all safety boundaries between them and the patient because they don't want to bring anything in the hospital as well.
Of course.
Yeah, I mean, you can think of leadership as understanding what you do or don't do and why. And so what I want to bring to this is to give leaders an understanding of what they do, what they don't do, and why they do what they do or don't do. And from that, try to affect some improvement in how leaders lead. And that will be essential for the culture change that's required to drive the improvement within the hospital.
Now, from the perspective of, I mean, the experts, of course, you when you talk, it sounds easy, right? But I think it's when you need to go and do it and ask someone to start, creating policies to share knowledge faster and more efficiently. And then when you go and try to be efficient on operations and management and all that is not that easy. But from the perspective of from Maria Juliana at the hospital, I mean, we know Colombia is reaching 50,000 deaths confirmed these days. So it's a huge number compared to its population, especially in other countries. So how do you think, Maria Juliana, these tools that Carlos and Dr. Emiliani and Young are bringing are helping your hospital and your operation and your care health? I mean, your healthcare to your patients.
Well, I think that by applying Shingo principles, by improving also the leadership in our workers, and also by sharing knowledge, people's behaviors are going to change, and that's what we want. If we improve our quality, the patient care, if we improve as a hospital, these changes will be reflected in our services and in the patients. And we want to impact patients, the community, not also the city, but also the rural, small towns that are near, because we have patients from those areas. So all these principles and all these models will help us to improve quality, to change the way of seeing the services. Also, we want to impact hearts. We want that outside the hospital, people said, well, we have good service. We are taking into account when we enter to the hospital. So by changing the way we share knowledge, the way our leaders are in communication with their teams, and by rules as humility, I think that we are going to impact.
Mm-hmm. Carlos, what else is on the table for the Shingo model to help not only hospitals but many other organizations, right? Because as I understand, the Shingo model doesn't only work for health industry or hospital. I mean, it basically works for everything.
Yes, and as a matter of fact, healthcare is the last industry where the Shingo model is being applied. Not that it's the last one on the list, it's just the latest one that's coming up now and applying the Shingo model. The Shingo model started off in manufacturing back in Toyota, back in after the Second World War, and then was picked up by Ford and other types of manufacturing plants. And today, it's very well known in manufacturing, biopharmaceuticals, and other types of services that are using the Shingo model. Only a handful of healthcare operations or actual hospitals are using the Shingo model. And the reason why it's a challenge, the Shingo model in a healthcare hospital, especially here in the United States, is because leadership here in healthcare is divided into two major groups. You have the administrative group and you have the clinical group. And when you have these two leaderships that are not aligned with each other, they have different visions and they have different needs, and they're also going towards different ways. They're really pulling apart versus pulling together. What makes the Magdalena project unique is that although these two entities exist, they're working as one entity under one leadership management, which means that they're willing now to adapt to the change. They understand that administrative functions and clinical functions need to work together. So when they're going to buy bedspreads or they're going to buy some kind of PPEs, they understand that that goes through purchasing, but it also is dependent on the clinical side for healthcare workers. So that's very key. Although here it might look in theory that way, when you look at their business strategy and healthcare, like I said, I've worked here in healthcare for 15 years in several different levels. You'll see that their strategies are totally differently aligned. Most of them are focused on different types of strategies or different types of projects. I think that the COVID-19 has made a wake-up call to the United States and healthcare, and also the impact that it's had not only on healthcare workers, hospitals themselves, but also on managed care, mental health care, and also providers that are supposed to pay for healthcare as well. The United States is the leading COVID case number in the world. We're already 200,000 deaths. And if you notice, in healthcare, leadership hasn't changed and hasn't stepped up to the plate and says, what are we doing wrong and what should we do different? So once we start seeing that, we start seeing that in other companies. We start seeing that, for example, in Google and other companies that have services that are saying we have to change from the way we were before. We can't continue to do business as we were doing it today. So healthcare needs to have that revolutionary change. It has to evolve from where it was before, and it has to totally revolutionize itself, reinvent itself, so that it can be more efficient and also more capable of meeting challenges in the future. This will repeat itself. We will have another pandemic. That's scientifically proven and also scientifically mentioned in all the news. We will have some kind of outbreak in the future, who knows when, hopefully not as bad as this. The question is, will we be prepared? Will leadership be prepared to make the right decisions and have the humility enough to understand that we have to stop what we're doing it wrong, let's change our paths, and let's go forward now with a better solution than was working before. And what I put on board now, sharing with the screen, is all the different types of challenges that the clinic that Magdalena has currently and the different initiatives that we're working on to try to address that. And we're trying to create a fundraiser so that we can have some funds for buying some basic necessities like bedspreads and pillows and so forth, which is a very big impact, knowing that a loved one is in the hospital and can't have a regular blanket to cover themselves. These are basic necessities that are needed. And what I like about the Magdalena, and I can't emphasize this enough, is that the leadership, starting from the president who called us in, to Maria Juliana and everyone down on her staff, have the right attitude and the right environment within themselves to say, we want to change. We need to change. We do not want to go back. And that's the key to having the shingle be successful in any place. Exactly the same thing with Dr. Meliani and with Dr. Young. Same way, if the knowledge management is not applied correctly, it will lose. If they go back to the way they were before, they would lose all the value that they've gained.
Now, another of the questions that we're receiving is how can people get involved in this? I mean, you're in your image here, you're asking volunteer contributions from the Latino community, and then you mentioned the idea of the availability of sponsoring sponsorship by hosting a Shingo workshop. So how that works?
So how it works is that we're a Shingo affiliate, licensed Shingo affiliate provider. So we provide certification in the Shingo model globally. We are not country bound. We're not also language bound. We can do this in 3 languages: Spanish, English, and Portuguese. And we are on the shingo.org website as a licensed affiliate. So what a host does, there's different types of Shingo workshops that are available. Now with the COVID, now we have virtual workshops, and we also have face-to-face workshops. And how it is it's a 2 or 3 day intense training where we are analyzing and then going out to the tours to go to see, walk out the Gemba, and go and seeing what's out on the field, what's in the manufacturing plant or hospital, and actually seeing the work being done and identifying the defects and opportunities for improvement as we identify them and align them to the principles of the Shingo model. And from there, we're taking lessons learned back. We're saying, you know, an ideal behavior of a leader is this, an ideal behavior of a manager is this, and an ideal culture of an environment should be like this. So we're putting a picture together of ideal future state, analyzing the current state that it is today. The whole site doesn't have to provide any type of fundings or anything like that. Basically, all they say is they allow us to come in as students. We can bring students into their facility and interview and work and go through and walk through a Gemba and see that process is being done. And then the students provide a report out to leadership at the end of the second day. We need a lot more sponsors that will host Shingo workshops, especially in Spanish. We're the only ones that are Shingo affiliate that are doing Spanish Shingo training. We could do it in English. We're certified in both languages, but we prefer to address and help our Latino community. How many Latinos have immigrated to the United States and Spanish is still their first language? And now giving them the opportunity to get a Shingo certification in your native tongue, I think is extremely valuable. And this is not, and again, not only locally here in the United States, but also globally. We will have the first ever Shingo workshop in Colombia in October 27th and 28th. And it will be a hybrid workshop where I will be on site on the hospital, walking the floors with Maria Elena and the doctors and interviewing and showing the different processes with the hospital. At the same time, we'll have students dial in virtually and seeing this live as it takes place. So that's the first Shingo event that's going to be happening this month and next month, I'm sorry, in October. And we're encouraging people to sign up to take that course. It's called Discover Excellence, which is the first Shingo course in the line of Shingo models to take. So the need for host sites and to volunteer to be a host site is an outcry. Right now, people are saying, well, we'll close. We don't have the business open. Well, we don't have enough employees. It doesn't really, those requirements won't impact at all us having a Shingo workshop. What we want to understand is how can we learn from your business, teach students what's going on in your business and or in your country. Because if you're like, in this case, it's Magdalena in Colombia, you could be in Ecuador, you could be in Mexico, you could be in Peru, you could be a host site as well. And it's a shared experience because now students are learning not only what companies are doing in different countries, but also what companies are doing culturally in other countries. and you're now sharing your experience globally with other people and learning from other people from around the world. It's a very unique experience, even though if it's being done virtually, where you can learn from other companies and other countries how they're doing their business, and then bring back that knowledge to where you're working today and say, we could do this better because what we've learned in the Shingo workshop.
All right. Now, back to, we have 4 more minutes to go, and I would like to go back to Maria Juliana and see and ask you, what is your immediate vision of the future? What are you seeing that is going on, not only there in your hospital, but in the region in which you are living in Colombia, in this state? What is your vision? What is your projection? What is your prediction of the situation?
Do you mean about the situation, the COVID situation, or do you mean?
Yeah, I mean the challenges that you're facing in your hospital are due to the situation of the COVID pandemic, right?
Yes. Well, so I think that by this project that we have already started, things are going to improve. We know that it's going to take time. As Carlos said, it's around 3 or 5 years, but we are very, very excited about it. We have recognized the problems that we have, but I think that starting is going to make the difference. We have planned like all the steps that we have to scale, but I think that, as he said, we're not going back. We're going to improve step by step, but it's going to be worthy. It's going to be worthy at the end, and that's what we really hope. We know that this COVID situation, it's not going to finish tomorrow, so we have to adapt. We have to make the changes that we consider necessary, and at the end it will also prepare us for, as he said, another pandemic time, and we will be better prepared.
Great. Dr. Emiliani, one last comment.
Well, maybe I'll give you a quote from quite some time ago. A gentleman by the name of Henry Gantt, about 110 years ago, said the usual way of doing a thing is always the wrong way. And that's a rather provocative statement, but what we find pretty much in anybody's work, including the work of leadership, the sort of the normal way you go about doing things, there's a lot of room for improvement. And so we want people to be open-minded to the possibilities that go with that in improving things, we can have a lot better experience at work and lower stress and be more effective in what we're so personally driven to achieve, what our passion is in healthcare. Of course, it's to help people. And so you want to really help bring that out further and make that happen to a greater degree.
Okay, thank you very much. Dr. Young.
Yes, the one last thing I'm going to leave everybody with is that knowledge management, this whole process is not just for the hospital employees. It also has to do with patients and their families and the interaction with the customers, because in the end, you know, we want to take care of those customers as well as the hospital staff. But the hospital staff, their knowledge management processes will eventually be such that no one will see anything different, but they'll work with the patients and their families, and it'll just have a better overall experience for everybody.
Okay, thank you very much.
Thank you.
Carlos, to wrap up your presentation and your comments.
So just to wrap up, just to mention, I put it on the screen there, the class that we're having now, the Discover Excellence class in Colombia, on October 27th to 28th. That's our website on the middle. And then to register, just email us directly at info@theguidingprinciples.org, and we will register you to take the class. The class is interactive. It's going to be a hybrid class. It's going to be extremely exciting. We want more healthcare host sites so that we can continue this type of training and of experience, especially if it's in another country. And we also want to share our knowledge with other people and encourage other Latino leaders to take an endeavor like we did to volunteer and sponsor and provide some kind of humanitarian effort to our brothers and sisters in different types of different parts of the world that we are as Latinos, we're all over the world. And we can use this type of opportunity to help each other out. So there's the website and our email. We encourage people to sign up for the course. You will enjoy it. I can guarantee you that much, that you'll really like the class.
All right. So from our perspective, as a magazine, I mean, we love when we found these kind of projects and this kind of work from leaders from different places, in this case from different countries, which are having a single interest, which is improve the conditions of a hospital. And with that, setting the example and the role model for many other institutions, healthcare or not, that want to improve. And we really like the approach of the Shingo model, the company of the guiding principles, the Phoenix, idea and story and meaning behind that is very powerful. And for us Latinos that are a very resilient community, I think it means a lot for all of us. So I really want to congratulate all of you, say that you are doing an exemplary work of passion, a work of love, a work of leadership, and that has to have many good consequences. And hopefully many people that are seeing this today and many others that will see it some of the other days that we are going to stream this panel could take note of these workshops and getting to the website and try to do something together. And thank you for your participation. Maria Juliana, thank you for the work that you're doing there in Colombia. And I think that the medical community is kind of our heroes of these days. And Carlos, thank you for your leadership and your strategy, the support from Dr. Emiliani, thank you, and the support from Dr. Young also. And it's been a pleasure to talk to you today. And I hope you have a magnificent rest of the day. And muchas gracias a todo mundo.
Muchas gracias.
Gracias.
Muchas gracias.
All right.